Hit the record button. There you are. You are all notified. All right. Okay. So here we are. We started these Legal Wellbeing Network meetings now over 2 years ago. It's been, I think, almost 3 years. And we have been meeting every other month. And I know many of you have been here, been to almost every single meeting. I see a lot of familiar faces, and we appreciate that. And we hope that this is a space where folks can talk about the importance of well-being in the profession and what we can do to make improvements and progress. And so it's always nice to see folks here and to hear from you. And today we are going to be talking about the recently released study on well-being of lawyers in Massachusetts. And the first thing I want to start off with, well, first I should introduce myself. I'm Heidi Alexander, and I'm the director of the SJC Standing Committee on Lawyer Wellbeing. And I know we have folks, I'm sorry I can't see you all here, but I know we have folks from our committee who are here, including one of our co-chairs, Mala Rafiq, who's going to say some words in a bit. And then lots of folks who are involved in many of the well-being efforts across Massachusetts and beyond, actually, because I see some folks from outside of Massachusetts as well. So thank you all for being here. So I want to start here. If I can advance my slide. All right. So some of you may have seen this. This was the headline of an article in the Washington Post on January 6th. And I'm just providing it sort of as some context for our discussion today. And this was the title: "The Happiest, Least Stressful, Most Meaningful Jobs in America." And as you might guess, it is not being a lawyer. And in fact, the analysis that was conducted by the Washington Post of data from the US Bureau of Labor Statistics found the most stressful occupation was being a lawyer. And so that was followed by, folks may have seen, this opinion piece in the Washington Post entitled, "Want to be happy? Then don't be a lawyer." And we know not everyone is miserable practicing law, but as you are going to hear today, even here in Massachusetts, there is definitely a reason for concern and reason why we need more attention and awareness of the well-being in the profession, and to talk about what we're going to do to make changes and support well-being and reduce burnout. So just for folks who are maybe joining for the first time, I just wanted to go back in time just briefly, just to kind of set the stage here and why we're here and why we're interested in this data. And it really goes to the movement around well-being in our profession, and many of you again have been quite involved in that. We've had research over time, and there continues to be more and more research sort of building on the research that has been conducted over time. One of the seminal studies in this area, which many people are aware of, by Patrick Krill, with support of the American Bar Association and the Hazleton Betty Ford Foundation in 2015, found high rates of stress, anxiety, depression, and substance use among lawyers. There was also a law student study that found similar results. And so that led to the establishment of the National Task Force and a national report, which I know many of you are aware of. And it provided recommendations aimed towards changing the culture of the legal profession. Here in Massachusetts, we had a steering committee established under late Chief Justice Gantz, and that led to a report. And so we have this great report that was published in 2019. And if you haven't taken a look at that report, I highly encourage you to do so. And I'm going to sort of reference that throughout the presentation here, because it is very relevant. And the report talks about specific recommendations for Massachusetts in particular, and all the different legal sectors. And then as of 2020, we have this permanent standing committee of the SJC that is working to implement these recommendations. Obviously, in collaboration with all of you and all of the stakeholders and partners. There's also a new organization that was formed that was sort of the continuation of the National Task Force, which is the Institute for Wellbeing in Law. It's a national organization, national 501c3 organization. All right. Let me just say that these efforts are going on not only in Massachusetts, sort of around well-being, but nationally through the Institute in Wellbeing and Law, but also there are a lot of state-specific efforts that are happening, and lots of states have created task forces or taken some sort of step to address well-being in the profession on a local, state-specific level. Of course, Massachusetts being one of those. This is our report. This is the contents of the report. You can see that these focus on all the different areas of our profession. And so one of the things that we do is we try to track those efforts and evaluate the progress. And so we know from tracking this, we know that a lot of these recommendations have already started to be implemented, and some of them are sort of constantly evolving. Some of them may take years, but there are things that we are working on. And I always encourage people to go back to that report and look at those recommendations, because there's a lot of really great things that we can kind of point to and say, okay, these are things we need to do. And I think that the data that we find in this NORC study really backs up those recommendations. So one of the recommendations in the SJC steering committee report was to collect data to help define programs and services and solutions. And so this effort was really a collaboration between the committee, Lawyers Concerned for Lawyers, and other stakeholders to conduct this statewide survey on assessing lawyer well-being. And so that brings me to sort of the reason you all are here, which is the data. And so this was conducted by an independent research organization, NORC, at the University of Chicago. And we are very fortunate to have some of our researchers here to talk about the results from the report. And so I think in the chat, Jenna has put in a link to the report, and there's an executive summary. There's also the full report. So if you haven't had a chance to take a look at that, I would encourage you to do so. So what I'm going to do now is I'm going to hand things over to Jenna Sirkin, one of the researchers at NORC, to tell us a little bit more about the report, the methodology, and the findings. So Jenna, over to you.
Great, thank you. And I just repasted the executive summary just because I think you can't see the chat if you joined a little late, but let us know if anyone needs the link. Thanks, Heidi. And I'm a principal research scientist at NORC at the University of Chicago, although I am based in Cambridge, Massachusetts, and a lot of our team is based in Cambridge, Massachusetts. I have lived in Massachusetts for the past 2 decades, and have been doing a lot of work in this area. I just want to recognize 2 of my colleagues who are on the call today. One who may be hiding out on Zoom somewhere off camera is Jared Sawyer, who contributed a lot to the report, and Sammy Agenbrun, who also is here and has contributed greatly to this report. So thank you both. And as well, the SJC Standing Committee, Lawyers Concerned for Lawyers, and other members who have been affiliated and reviewed aspects of the report. So thank you so much again for all of your comments throughout this process. So I just wanted to start and give you, and Heidi, I think you can go to the next slide, an overview of just the research aims and kind of the approach that we took for this report. So we worked with the Standing Committee and a group of individuals who helped us to define what the research questions were that were of interest to this group based on work that had been done in the past and what they wanted to explore in Massachusetts specifically. So we assessed the current state of well-being in Massachusetts. We wanted to understand how this varied by different demographic and employment factors of individual lawyers. We wanted to understand who is seeking mental health and substance use services and the barriers to seeking those services. And we also started to explore some of the policies and programs that are recommended to improve Massachusetts lawyer well-being, although I think that this was kind of preliminary and the work that we've done and is certainly ongoing work of the Standing Committee and Lawyers Concerned for Lawyers and other groups in the state. And I think we can go to the next slide and I'll talk through the methods. So this study really included 3 different stages. We started doing some formative research. So that included, a literature review, that's our environmental scan. This really informed, we wanted to understand what kind of research was out there, what surveys that had been done, what surveys had been done among lawyers. We also did, there's a large body of work on physician and burnout in the healthcare workforce. So we looked at that literature as well. We then created 2 focus groups and talked to individuals in the private and public sector. That informed the design of our survey instrument. And that we went in the field and collected data January 2022 to April 2022. And some of you may have participated in our survey, so thank you very much. And this was a survey that we developed in collaboration with the Standing Committee and kind of other members of the committee, Lawyers Concerned for Lawyers as well. And we invited all attorneys within the 2021 Massachusetts Board of Bar Overseers registration list to complete the survey. And everyone received an email invitation with a survey link. We also did some promotion of the survey through bar associations and other advocacy groups as well. So you may have seen that promotion, with outside of your individual email invitation. We only active and registered attorneys were eligible to complete the survey. We had 4,450 who provided complete responses to the survey. And that was out of about 58,000 lawyers at the time who met the eligibility criteria. One of the strengths of our survey is that, and this is unique and is not always the case in some of the other literature that's out there, is that we were able to weight responses so that they could be more representative of lawyers in Massachusetts. We used the Massachusetts Supreme Judicial Court Demographic and Law Practice Survey, which is a survey that is completed as attorneys do their registration in Massachusetts. So we had a sense of what the true demographic makeup of lawyers in Massachusetts was, and we were able to weight our data to that, which is a real strength of this survey. And I think, and then, we worked through kind of the analysis areas of focus, and the report was released in February of this year. So I think we can go on. Great. So the next few slides will share some of our initial findings. I just wanted to flag the well-being measures that we looked at. So there are a lot of ways to measure well-being, and part of the formative research that we did was to really kind of review that literature, have discussions with the Standing Committee, and use our focus groups to think about how we wanted to measure well-being for this study and what would be kind of salient and relevant for lawyers in Massachusetts. So these are our key measures that we used in the study to measure well-being. We looked at satisfaction with life as our kind of positive measure of well-being. We looked at burnout, anxiety, depression, and hazardous or unhealthy alcohol use. The majority of these measures are validated survey instruments, which means they've been tested and used in other studies to ensure that the results are as reliable and accurate as possible. Some of these measures you actually may hear in clinical settings. So for example, the PHQ-9 and the GAD-2, the measures for anxiety and depression, sometimes are asked in appointments when you go see a clinician. So you may actually be familiar with some of these measures. I'm going to go to the next slide. So these are our high level findings across all of our sample and of lawyers in Massachusetts. So we found 2/3 of Massachusetts lawyers reported overall satisfaction with their lives, but more than 3 in 4 lawyers reported burnout. So 77% reported burnout, sometimes, often, or frequent burnout. We also looked at considered leaving a legal employer, considered leaving the legal profession. So almost half said that they were considering leaving an employer, considering leaving the profession, a little bit less than half. Anxiety was 26%, 21% screening for depression, 7% screening for suicidal ideation, and 42% hazardous or unhealthy alcohol use. And I just wanted to note that, the juxtaposition here of relatively high satisfaction with life, also coexisting with some of these high levels of, professional burnout, anxiety, depression, unhealthy alcohol use. Okay, we can go to the next slide. Great. So one of the,
sorry, I skipped one.
Yeah, that's fine. No problem. Keeping me on my toes here today. So we also compared to other studies that had been done in other states, and you can look, and this is there's more detail on this in the report. I'll just say that this is challenging to do because the measures aren't always exactly the same that they use in some of these other studies. Their methods aren't always the same. Some don't weight their data, and the time periods are really important. So this was a study that was done in 2020, or winter 2022. Some of these other studies we're comparing to are very early in the pandemic or before the pandemic. So that, pandemic effect, I think, is something to really pay attention to when you're comparing to other studies that are out there. But in general, our results were slightly higher than California and DC lawyers for anxiety and depression. And for the general population, we were also higher, but again, I'll say these are different, pretty distinct time periods. It was hard to find a survey that had been done to kind of match that time period using similar measures in the general population. So we can go to the next slide.
The next few slides are on some of the demographic differences.
So these are, we're just showing here kind of some of the key demographic differences that we found were significantly different between groups. So there's a lot more detail in the report. If you're interested in this, you can kind of dive into groups of particular interest. So we found higher rates of burnout, depression, and anxiety, and lower satisfaction with life. So higher rates among lawyers who are identified as female, non-heterosexual, or with a disability. And just to define, the non-heterosexual group includes lawyers identifying as asexual, bisexual, pansexual, homosexual, gay, lesbian, queer. And we had to group these identities due to sample size constraints. Similarly with gender identities, we didn't have enough sample and identities beyond male and female. So those were excluded from the analysis, but we recognize the importance of reporting on well-being for all gender identities and wanted to note there's more information on that in an appendix in the report. But for the statistical analyses, we needed enough sample to be able to do this comparison. So this slide just shows some of our high-level findings by race and ethnicity. So lawyers identifying as Black or African American, Hispanic, or Latinx were reported higher burnout. Lawyers identifying as Black or African American reported lower satisfaction with life. Asian lawyers reported the higher satisfaction with life. And then, we we explored this for anxiety and depression and actually didn't find any significant differences between the groups. We can go to the next slide. So, and this one probably is not surprising that we found higher rates of burnout, depression, and anxiety and lower satisfaction of life among lawyers who self-reported fair to poor health, diet, or physical activity. So there, those two kind of challenges coexisted together among many of the lawyers responding to our survey. And this maps to other studies and what we find in the general population as well. Heidi, I think pass back to you. I'm happy to weigh in.
Yeah, so I think there's some additional highlights that we want to share before we engage in discussion, but I also just want to kind of stop here and recognize that the data is not very positive, also not surprising. And even though there are people that are thriving in the profession, many of them are not, and many of them are people from marginalized groups. So we want to recognize that and recognize that really this is an opportunity to spread awareness and start making changes. And I know that's why many of you are here. And this is sort of a call to action I gave at the recent Mass Bar Association well-being program that we had. And I know other folks have things to say, and so I'm not going to go on and on here. Actually, Amanda Rowan had a very eloquent and powerful speech that she gave, which I am hoping that she will publish and that you will all get to listen to or read. And I'm pretty sure she's here. So, and I'm sure she will chime in. But I want to just continue and share just a little bit more in terms of the highlights, and have Jenna help me with that, and then open it up for discussion. A couple of the additional highlights and things that are cause for concern. One is that lawyers who screen for mental health issues and substance use are not seeking help. And so, Jenna, do you want to explain the couple of these slides related to access to care?
Sure. So we asked lawyers who screened for depression or anxiety whether they were seeking care for mental health or substance use services. So only of the 32% who did screen for depression and or anxiety, only half had sought mental health care. The good news, I'd say, compared to kind of the general population, is among those who did seek mental health care, they are receiving mental health care. And we know from a lot of other work that I've been doing in Massachusetts that there are challenges in getting care when you seek care, long wait times and other barriers. And so I'd say that's kind of the positive news here, but that it's a pretty high percentage who are not seeking care but screening for depression and anxiety. And then on the slide also suicidal ideation. Similarly, about half, only about half sought mental health care, which is pretty alarming and concerning. This was a very alarming statistic here, that so about 42% screen for hazardous or unhealthy alcohol use. And again, these are validated measures that are very commonly used to assess unhealthy alcohol use. Among those who screened, 98% did not seek any substance use care or services, and only 2% had sought care. And I guess the positive news I will say among this is that of those 2% who did seek care, that 3/4 of them received substance use care. But this is something that I think differs a little bit from the general population, where the big gaps here are people are not seeking care, and that's very concerning among this population. I think it is certainly an area where there can be targeted policy and program interventions, and I know groups here are working on this. So and unhealthy alcohol use is, it continues to be a problem, particularly among certain groups of lawyers. So lawyers with higher rates of unhealthy alcohol use included the following groups. They were younger lawyers. They were more likely to identify as white, more likely to identify as female, which is different from what you generally see in the general population. They reported more work-life conflict. They were generally people who were working 45 or more hours a week, so people working significant hours, making more than $150,000, and did not identify as having a disability. And if you remember the slides I presented before, I think the groups who are affected by unhealthy alcohol use are slightly different. The demographic groups and those identities are slightly different than anxiety, depression, and burnout we saw. So I think this is another area that we've had a lot of discussion around, and I'm sure there will be thoughts on this, that we asked those what were the most common barriers to seeking mental health and substance use care. The by far most common barrier was stigma, 88%. Time was a significant barrier, 63%. Punitive concerns, and costs, about 1/3. I think this is, again, an area, when you're thinking about that gap that we showed before between those seeking care and those receiving care, an area where there could be more attention to, what are some of the causes of that.
Right. And this is certainly an area that I know lots of folks here are working on. The other sort of major finding was related to bias, harassment, discrimination, and vicarious trauma. And so we want to talk about some of those findings, including that are starting here in terms of the number of lawyers who reported experiencing bias, harassment, and discrimination in the legal profession. And so the findings were that over a quarter actually reported experiencing bias, harassment, or discrimination. And then we have 2/3 reporting experiencing vicarious trauma from legal work. Jenna, do you want to talk to any of these? I don't want to make you speak to every, but you're the expert.
I just say, across the board that those experiencing bias, harassment, and discrimination there's a very negative impact of this, right? For burnout, anxiety, depression, and certainly satisfaction of life. And this is not surprising, but we have data now to show this. And given the percentage of lawyers who had reported experiencing bias, harassment, and discrimination, I think this is an area, again, for, further work and attention.
And particularly in considering like this slide here, who are the lawyers that are experiencing this, right? So higher rates of experiencing bias, harassment, or discrimination and experiencing vicarious trauma occurred among lawyers who are younger, who identify as female, who don't identify as heterosexual, and then who identify as Asian, Black, African American, Hispanic, Latino, and who identify with having a disability, including those who reported overall worse health, diet, and less physical activity. So demographics here are certainly important. And then this, I think, is also, not something that people are going to be surprised by, but of course goes to, efforts related to improving civility and interactions, particularly in the court. And this was the finding that over 1/3 of lawyers reported that bias, harassment, or discrimination actually came from attorneys who were representing other parties or from their current places of employment. And then you see also here, they're also reporting it coming from the former places of employment and the court, which is also important, and obviously sort of goes to some of the work that we've done with the affinity bars and the affinity bar town hall report, which folks may remember, and sort of lived experiences from folks in the courtroom. So all very important findings for our work. And then finally, before we open it up here, I think this is maybe a more positive area and provides maybe some practical recommendations for workplaces and what workplaces can do to improve well-being, and that's providing a supportive work environment. So Jenna, do you want to speak to some of the data here?
Sure. So we looked at, for the survey, we kind of had to narrow down to some areas that we were going to look at for supportive work environment. So we had some questions around being treated with kindness and respect, having a positive supervisor relationship, supportive colleagues, schedule flexibility, time to recharge, access to mentorship, and opportunities for promotion. And so these were areas, that a lot of lawyers reported having a supportive work environment. And you can see here among these different factors, I think some of the slides coming up kind of talk about how that differs among different groups and for burnout, when you're looking at it with some of these well-being measures. And so Heidi, I think you can go to the next slide, show you. Great. So having a supportive work environment, we found, was associated with lower rates of burnout, anxiety, depression, and greater satisfaction with life. And this was pretty much across the board. We found this across all of these factors. So just want to, again, these are things that you have all experienced in your career, but it is really nice to have data behind this to support that those who are reporting having more supportive work environments were doing better across pretty much all of our well-being measures. And then these slides, oh, go ahead, Heidi.
No, you go ahead.
I think the trends, and maybe you want to speak to that. This one, there are different trends by types of firms, right? Not just firms, but the sectors as well, right? Public sector versus private sector. And you can look at this, the down arrow, the red arrow is saying that there is less likely, and the green arrow is saying there's more likely to be a relationship. But I think the next slide, we saw more consistent trends. But Heidi, I don't know if there's anything else you wanted to say about the specific employer type employment types.
No, I mean, I think these are all things that we have recognized and sort of recognized in the 2019 report as well, and are sort of areas of interest and areas that we're working on. But I also think the one that is very interesting down here is the folks who are working over 45 hours sort of have all these factors, these negative factors, but then the one positive factor is that they have opportunities for promotion. And so, sort of questioning what that says about how we sort of incentivize in this profession.
And the negative experiences aren't just in the private sector, right? They're also, I think that's another important point here, is that we're seeing this and in the public sector in different types of, in different size firms and different types of solo practice versus practices with 2 or more lawyers as well.
Right. And the last slide, I think is really important, particularly related to our work with diversity, equity, and inclusion, And the general trend is that certain groups have less supportive work environments. And you can see that, like Jenna said, across the board here, right? So folks who identify as female, Black or African American, having a disability, or fair to poor health have less supportive work environments. So again, sort of thinking about issues of equity and inclusion in the workplace that I know many of you are focused on. So what I want to do here is hopefully open it up for some comments and discussion, because part of what we want to do is we want to, we're providing this data so that we can hear from everyone and what your thoughts are, and how your reactions and what you want to do as a result, and what we can all do together. That is extremely important. So I'd like to first turn it over to Mala Rafiq, who is one of the co-chairs of the SJC committee, and then Mala will have Stacy Best, the executive director of LCL, follow you. And after the two of you kind of transition us into the discussion, what I will do is I will stop the recording so that people feel like they can speak in whatever way they would like without fear that it's being recorded. All right, so over to you, Mala.
Thanks, Heidi, and thank you everyone for being here. It's gratifying to see. So, whoops, my screen just went crazy. It's
sorry, that was my fault.
So many, yeah, thanks, Heidi, for throwing me off.
No problem.
So many people care about this, and so many people sign up for this and I feel like you're here because you want to make a change. I became involved in lawyer well-being back in 2015 when I realized that I was essentially eating myself to death because I was feeding my anxiety. And that's how I was coping with the burnout, with the stress of this profession. And, I realized also that I was really quite lucky. I ran my own firm. I could make the changes internally. I could change the way we work for everybody and not just for myself, which is not to say that I'm a shining example of lawyer well-being, because I am the exact opposite. So it's do as I say, not as I do sort of world. I'm the poster child for what not to do in many ways. But I think that despite all of that, there's a lot of hope that comes out of this report, other than the fact that we're just talking about this, we're acknowledging this. I represent in my practice many lawyers who are impaired. I represent individuals who are chronically ill and disabled. And one of the trends that I have seen in the last couple of years is, rather than have lawyers come to me when they have been hospitalized or they've almost died because of their alcohol use or because of the suicide attempt, they're coming a little earlier, right? They're coming when they are feeling impaired and they're saying, I need to take a break. And that's a wonderful move forward. It's still distressing to know that people are suffering, but at least we're talking about it and we're getting help. And there's a lot of reason to hope. And we clearly like what we do, and we like who we do it with. We have satisfaction in our lives. And I don't see that as inconsistent at all in any ways. We do what we do because we like what we do and we like who we do it with. We just need to do it better. And so I think that, I love Stacy Best, and I'm going to turn it over to her, but I love her because she's a lot like me. We need to think about this practically. How do we make change? And it's beyond taking care of ourselves. It's beyond going to the gym and doing yoga and meditation. It is institutional change. And how do we make that institutional change? How do we stop rewarding bad behavior? How do we stop rewarding people for working 3,000 hours a year by giving them a higher bonus? Or by saying to people, the longer you stay in the office, the more likely you are to be promoted. How do we normalize speaking up when we see discrimination? We need to start doing that. We need to start supporting our colleagues. We need to start saying, just not being afraid to speak up. And we also need to engage judges, because the people in power, the leaders, so that means the people who run firms, but also the judges, need to be upstanders. They need to speak up. So how do we take the next step, and how do we make practical change? And I think one of the reasons I love Stacy is that's what she focuses on, and that's what her message is. So I'm going to turn it over to you, Stacy, to hopefully tell us how to solve all these problems.
Thanks, Mala. I don't know how to solve all these problems, obviously.
Well, thanks.
Stacy,
So,
one thing here is that, are you actually on camera or do you just have a screen?
Oh, am I
I don't know if you're
sharing my
meaning,
screen? Am I like
I
sharing
don't
my
know what,
business?
what's happening here. But are you trying
I
to be on
turned,
camera?
no, yeah. Oh, I see
Okay,
myself. But I see what's supposed to be myself, but I don't even know what that is. I apologize.
no, that's okay.
Oh, I'm sharing
I
my
just didn't know if
camera.
that was intentional.
Oh, here I go.
There you are.
It
Okay.
was on some weird setting saying share camera, so maybe it was looking at the bushes. I don't.
I thought you had this vision of how we were going to solve all these problems.
Well, it's sort of funny because
And
I
that
saw
was-
the camera come on and I looked, I was like, oh, well, maybe somebody got in my spot.
No, you're here.
Anyway, sorry. And sorry to be taking up people's time. So, my perspective on the report and the data in terms of so the dismal nature of it is similar to what Mala said about understanding the people problem. And the people problem, we've heard a lot about strategies for individuals. We've heard a lot about strategies that leaders need to take. And they're often very concrete suggestions. One of my observations about the supportive work environment has to do with the fact that when there is a diverse environment, there is more likely to be conflict. And some of us might be tempted to believe that that's a negative thing. In my mind, what it means is that we need to take greater care of one another. We need to be more thoughtful about our interactions with one another. And so when looking at the data of those who don't feel supported, some of that is internal, but some of it is external. And so one of the things that I think we hope to look at is how can we reduce the friction in terms of that internal external push pull. In other words, if we just take our common experience, if somebody comes to you and they are saying something to you that feels like an allegation, that causes you stress and tension. And they may not be intending it to be an allegation. They're intending to tell you what they think and what they feel. And so in the position of leaders and judges, they are under all sorts of pressures and stresses like each of us. And one of the things that I think we need to work on is how to help them cope so that they can respond more positively and appropriately to the circumstances and the people that they're dealing with. When I was talking about this at the MBA meeting, there are some sociological studies that talk about how people interact when they feel threatened based on their identity and a stereotype. And those stereotypes don't have to be about race. They don't have to be about gender. They could be about what it is to be a boss. They can be about sort of any group or identity to which we belong. And so it is that sort of push-pull that in a given communication, both people can be feeling stress that causes that communication to feel less supportive, that causes the environment to feel less supportive. And one of the comments that came through during that session was one of the best things that I guess agencies and whatnot can do for employees is have well-trained managers and leaders. And I take that to mean, and I think it's actually a very good suggestion, because a lot of people who end up in leadership roles are actually better managers and administrators than they are leaders because they haven't received training on how to be a leader. And so I think that's one of the things that we can be working on. And then the other thing is to help people appreciate that just because someone is in a leadership or managerial role doesn't mean they aren't in a position of stress in responding to you in their stress. And so how can we take a step back from that, name it, identify it, and address it respectfully so that we can move on and move past. And then, of course, there are all these external factors that aren't even part of the legal profession in terms of some of the vicarious trauma that we experience. And so it may not be related to the actual work environment that someone comes into the workplace with stress. It can be sort of the general the impact of general societal trauma that is troubling a person to the degree that it impacts their performance. And I hope that at the end of the day, we all sort of appreciate that when there are people suffering in our environment, we all sort of suffer. You may not think you're suffering, but it impacts the bottom line. It impacts, what you're able to do around and in your environment. And so we all do well to try to do well. And I'm sure that's why we're all here. I'm going to stop there. And I really appreciate Heidi and Jenna and Sammy. I appreciate all of those that sort of allow me to be part of the project. But I really appreciate you all sharing the data with a greater degree of granularity so that people could sort of understand when I'm saying that it's people, as Brene Brown would say, and understand what I mean when I say that if we look sort of deeply at that demographic data, what we're seeing is that people are suffering in relationship to their relationship to other people. Thanks.
Thank you. Thank you, Stacy. Thank you, Mala. So what I'm going to do now is I'm going to stop the recording, and I would like